typically I've seen this best for like shin splints or, you know, that's usually shin splints. All right, so what you want to do is you can do this a couple different ways. If you're able to get this to pull out, you can use it this way, okay? Some clinics, instead of using a big thing like this, they'll tear around the paper, okay? And just use the rest of this to kind of come up and over. For us, it's much easier on a stick, okay? So what you're going to do is you're going to rub this over the affected part, okay? So if she has shin splints, I'm going to make sure I'm going up and down, okay? It's an ice massage. You don't just hold it there, okay? If you hold it there, it's going to freeze and it's going to hurt, okay? And then you continue to go until they've reached all the levels of cold. Have you guys learned CBAN yet? Yes. So what are the different levels? Cold, burn, one more A, analgesia, good, and then numbness. So you want to make sure that they go through all of those levels until they get numb, okay? You're typically going to see the skin turn very, very red. That's okay, okay? In the book it says it may take about 5 minutes.
My skin's numb.
Yeah, to get numb, okay? You can go longer, 10 to 15 minutes, if you want the muscle to be cooled underneath, okay? So it just depends on the depth of what you're trying to achieve, okay? My athletes, they tend to get very red along here before they've really kind of met the numbness, okay? As you're going, you want to make sure that you're sopping up the water that ends up getting cooled, and you want to make sure that you're cleaning it up, okay? So make sure it's not on your table, it's not dripping onto your floors, okay? And you want to make sure that you're going along and drying up the patient, okay? Making sure that it's not going to get on their clothes, making sure that it's not going to get on socks or shoes, okay? That one make sense? Any questions? And this can be used anywhere on the body as well, okay? Doesn't have to be just legs, feet, toes, whatever, okay?
One of the things too is when you freeze these for other patients, do you see how far we push down the stick? That also will vary. So if you know that you need about half the cube of ice for them to get numb the next time you do this, when you freeze it, you only stick the lollipop in halfway, so that way you don't have to deal with working around the end of it. Or you have to go to the side of it. You don't want to use the sharp edge, it's incredibly uncomfortable.
Any questions? Yes?
You always go up and down?
I mean, you can do whatever area size. You know, if you're working with the back and you're looking for paraspinals, then you go up and down. If you're looking for QL, you may want to go, you know, a different way. You can go circles, you can make little patterns. As long as you're just getting that area cool. Yeah. It's not like ultrasound where you have to do a certain pattern or anything like that. That's good. Right?
Just my injuries, excuse me. Neil, stop it.